Good morning, Motherhood Moment.
Good morning. Thank you for joining us. To begin with, tell
Thank you
me
for
about
having
the
me.
State of the Pain survey. What did it evaluate?
Well, the State of Pain survey really looked at a problem that I think has been unrecognized for a long period of time. And that's the amount of acute pain that affects Americans and how is it is perceived by both patients and providers. In other words, how do patients and providers feel options for treating their pain are available? So shockingly, 80 million US adults are prescribed pain medication for treatment of acute pain, which is described as pain lasting less than 3 months. And of those, half, 40 million, are prescribed an opioid. And yet, patients and providers alike are unhappy with their options. And so the State of Pain survey was commissioned by Vertex to talk to both providers and patients, and they spoke to over 500 healthcare providers and over 1,000 18-year-old adult, 18-year-old plus adults who had had an episode of acute pain within the last year. And it really showed how much of a gap there exists between what are currently available for treating acute pain and what patients would like to see available for them and the providers as well.
Can you tell me some of the key findings and what you learned?
Well, some of the key findings just really gave us some hard data, and data is what we really need. It showed that from a prescriber's perspective, over three-quarters of prescribers felt that patients needed an option of something other than what is currently available, other than different types of medications. And a surprisingly, almost 90% of prescribers reported that their patients were looking for something other than an opioid. And from the patient's perspective, the survey showed that pain is more than just a physical problem. And even though 70% of respondents reported that they had difficulty doing exercise or walking, an almost equal number of them had difficulty sleeping, and over 65% of them reported that they had trouble just doing their hobbies. Additionally, and surprisingly to me, a large number of patients missed a huge number of days of work. On average, in the survey, 19 days of missed work were reported by the people who responded to the survey. And of the survey respondents, almost three-quarters wished to have some alternative to a narcotic and reported that the next time they do suffer from acute pain, they will seek something other than narcotic for managing their pain.
Why is it so important to focus on pain management right now?
Well, pain management has been obviously a long-standing problem in the US and elsewhere, and it's not something that's received an awful lot of attention. And it's really hard to get data about how big the problem is and what people perceive, both providers and patients perceive to be options and a review of what there's currently available. And now that we are getting some data and understanding how dissatisfied both prescribers and patients are, having this information allows prescribers to have a conversation with their patients about how to manage their acute pain if and when it does occur.
Where can people learn more about the State of Pain survey?
Well, I would encourage patients to speak with their physician, first of all, but then also go to the vrtx.com website, which has a lot of additional information about managing acute pain and also options for people trying to understand how big a problem this really is.
Thank you so much. Have a great day. Appreciate it. Bye
Thank
bye.
you for having me.